Now, come on up. Right here.
This is a slump test.
So a slump test kind of assesses very similar to the straight leg raise test. If someone has some of these radicular symptoms, I'll usually do both of these, unless they're just super irritated and inflamed. So it's very similar in its design that we're going to add different neural tension to kind of see how symptomatic she is. If she's positive at all, distinguish whether it's like differentially diagnose whether it's muscle tightness or nerve irritation, and then see if we can do some sort of retest to improve movement or decrease pain. Okay, so they're the kind of things we help out with: improve function and decrease pain. So the way you do this, she's going to start. You're going to tell her patient, "I want you to just sit with the rounded back." Good, and you can look straight ahead. I want you to place your arms behind your back. And at this point, this is your first test. If this position causes her symptoms, you don't need to do anything else. Okay, usually it doesn't. Usually it takes a little bit more than that. So what you'll do as a clinician is you'll place a little bit of pressure through her shoulders as if you're trying to push her shoulders to her thighs. Okay? We're trying to elicit some flexion into her. You got anything? Okay, good. So she's good there. So then what I tell her to do is now I want you to flex your chin down all the way to your chest. And she might be feeling a stretch and everything here, so we'll do the same thing. Anything there?
No, you stretch.
Okay. Then we'll add another component. Go ahead and try to straighten your right leg as much as you can. Do you feel anything there?
No.
Then we'll add another component. We'll pull back onto her leg here. Do you feel anything there?
More yet. Just touching.
And then the last thing you could do would be to flex their hip a little bit more.
Yeah.
So like for her, and really anyone in the room, if you were to do all those and then lift or flex the hip, you'll probably get some on there. It's called the Hoover test. The Hoover test is a test for malingering. Do you guys know what malingering is?
Someone who doesn't really need treatment.
Yeah. Say it to everybody.
Someone who doesn't really need treatment.
But they
pretend they're patient.
They pretend that they do. So, this is kind of a touchy subject because you never want to accuse someone of faking an injury or an illness or whatever. But there's some things as clinicians we can do as far as observations and things goes to try to determine if their symptoms match up with their presentation. And I've only had one patient that I've ever caught as a malingerer, and it's for his knee. It makes sense. I digress. So this test, the Hoover test, I guess it's probably made up by a workman's comp doctor. Here, go ahead. That's what I'm thinking. So the Hoover test, you have the patient laying supine, and then you cup both of their heels, and you just let their legs relax. And then you ask them to lift one leg. So go ahead and lift this leg for me. And then back down, and you see if they have pain or not. So go ahead and lift the other leg. Good, and back down. So really try to relax your legs, and then do it one more time for me. Good, back down. So what you'll feel here, if the person can't lift their leg, then you know something's up, because they should be able to at least activate some muscles to lift their leg, right? But what you're really feeling for is when they lift their leg or attempt to, they're going to push down in that opposite side hand pressure to get some counter force to get some tension to raise up. Okay? So do that again and just feel this side when you do it. And you can feel you're pushing some pressure into my hand when you lift up. So go for it. So right now she's pushing into me. Good, and then back down. So what a person will do, you'll have their heels and you'll say, lift your leg. I can't. But you don't feel anything. So are they trying? They're not getting any core activation. You're not noticing any quad activation, nothing. So could be a sign of someone who is malingering or not trying as hard and wants to kind of cheat the system a little bit. It does not happen very often, but it's a test I learned, and I use it actually, I wouldn't say frequently, but every once in a while I use it. And